Hi, so I'm the doctor here, and you're going to be the patient who is seeking benzodiazepines. You have a drug addiction, but you're going to try and deceive me to get the medications. So let's start. Hi, how are you today?
Hi, doctor. I'm doing okay, I guess. I've just been really stressed lately and having a hard time sleeping. I've tried everything and nothing seems to help. A friend gave me a pill a while back. I think it was called Xanax, and it really helped. I was hoping maybe you could prescribe something like that for me.
Well, let's have a chat about things. Now, can you remind me what's your name and how old are you?
Oh, sure, doctor. My name is Alix, and I'm 34 years old.
Right, and if you don't mind me asking, what sort of work are you doing and what's your social situation at home?
I work in sales, which can be pretty stressful. As for home, I live alone. It's been tough, especially with the work stress and not having anyone around to talk to. That's probably why I've been feeling so anxious and having trouble sleeping.
Yeah, I'm really sorry to hear that you're having trouble sleeping. That can be very frustrating. Let's just get a little bit more information because I haven't met you before. Would that be okay?
Of course, doctor, I understand. Ask me anything you need to know. I really appreciate your help with this.
Yeah, well, I noticed that you seem to have come to our clinic right from the other side of town. How come you came to our clinic today? You're very welcome here, but it just seems unusual.
Oh, well, I heard really good things about this clinic and I was just feeling desperate for some help. I guess I thought a fresh perspective might be beneficial. Plus my usual doctor is currently unavailable.
Yeah, no problem, no problem at all. So, are you currently taking any medications for anything?
No, not really. I mean, I've taken some over the counter stuff for sleep, but nothing seems to work. That's why I was thinking maybe something stronger, like what my friend gave me that one time, might help. It was just one pill, but it made a huge difference.
Do you have any past medical history, Alex?
No significant past medical history, doctor. I've generally been pretty healthy, just the usual colds and flu, no chronic illnesses or anything like that.
That's great. And you're not allergic to any medications?
No, no known allergies to any medications. I've always tolerated everything pretty well.
So tell me a bit more about the trouble sleeping.
Well, it's been going on for a few months now. I just lie in bed and my mind won't stop racing. I'm constantly thinking about work and stuff I need to do. I've tried reading, listening to calming music, even some herbal teas, but nothing really works. On the nights I took that pill from my friend, I slept through the whole night. It was such a relief.
Okay. And you've said a couple of times that work is pretty tough. What's been going on at work?
It's just been really high pressure lately. Our targets have increased, and there's a lot of competition. I'm constantly worried about meeting my goals and keeping my job. It's a lot to handle and feels like it's all piling up. It's hard to switch off after the day is done.
Yeah. So just to be thorough, can I just check, are you drinking much alcohol these days or taking any other drugs, smoking weed, anything like that?
Well, I do have a couple of drinks in the evening sometimes just to unwind. It's not every night though. And no, I don't smoke weed or take any other drugs. Just those occasional drinks to try and relax.
Yeah. Okay. Well, look, I'd like to have a chat with you. I know you've mentioned that the Xanax that your friend gave you helped you quite a lot, But I'm not sure if you realise, but they're quite addictive, those style of medications. We've actually limited prescribing of those by GPs and generally in Australia.
I understand, doctor. I didn't realize they could be that addictive. I just remember feeling so much better when I took it, but I trust your judgment. What do you suggest we do? I really need some help to manage this stress and sleep issue.
Look, I can definitely help you with a few other strategies that we could use for your sleep. And also, I have some ideas for managing the stress. So, would you like to talk about some of those?
Yes, I'd really appreciate that, doctor. I'm open to any suggestions you have for managing my sleep and stress. What strategies do you recommend?
Yeah, well, look, I do have a slightly awkward issue I've got to talk to you about. When our patients check in here and they want prescriptions, our staff actually check on the register if the person's been going to lots of other doctors for prescriptions. And it does seem like you've been getting quite a lot of Xanax and Valium prescriptions from other doctors around town. So it's not personal, but this is just our process because we are a little bit worried about these medications. What do you think's going on there?
Oh, I see. I guess I should be honest with you, doctor. I have been going to different doctors. The stress has just been overwhelming, and those medications were the only thing that seemed to help. But I realize now that it might not be the best solution. I'm really looking for help and willing to try the strategies you mentioned for managing my stress and sleep issues.
Okay, I'm really here to help you and I have your best interests at heart. And I'm not judging you about it. It sounds like it's been a really difficult time. But can you level with me how much of the medications you're actually taking at the moment? Because we might need to make a plan to wean you off those gradually. It's a bit hard when you just stop them suddenly.
Thank you for understanding, doctor. Honestly, I've been taking them more frequently than I should. Probably every day for the past few weeks. I know it's not good, and I'm worried about it too. I definitely need help to stop, and I'm worried about just stopping them suddenly. I'm really willing to follow any plan you suggest to wean off them safely.
Yeah, do you know what dose of Xanax you've been taking each day?
Sorry, an unknown error occurred. Please try again later.
Okay, are you back online now? Can you tell me what dose of medication you've been taking?
Yes, I'm here. I've been taking about 1 milligram of Xanax most days, sometimes a bit more if I'm feeling really stressed. I know it's not a good pattern, and I really want to change that.
Yeah, well, look, I mean, I'm happy to be your main doctor and we can work through it. We would probably swap you onto a different medication that's a little bit easier to get off. And then we'd make a process over the next month or two where we're gradually going to get you off the medication. But it does really require for you to be upfront and to make me your main doctor and not be going to any other doctors. Are you up for that?
Absolutely, doctor. I'm willing to make that commitment. I understand the importance of being honest and sticking with one doctor throughout this process. I really want to get better, and I'm ready to follow your guidance on this. Thank you for being willing to help me through this.
Okay, I'm really happy to help you. So I think let's put that plan in place, but at the same time, let's explore a bit more what's going on with your work stress. And I have in mind that we might get a psychologist to help us as well, as it sounds like things have been pretty stressful. Would you be interested in a referral?
That sounds like a really good plan, doctor. I think getting a psychologist involved would be helpful. The work stress has been a big part of the problem, and it would be great to have someone to talk to about it. I'm open to that referral. Thank you for suggesting it.
Okay, well, for today, we probably can't get everything done, but we seem to get on pretty well. And I'm really happy to book you in a couple of days so we can start putting that plan in place. I'm happy to give you medications for a couple of days just to tide you over and look forward to seeing you. And we're going to make a withdrawal plan and link you in with a psychologist to help with the work stress. And I've been through this with lots of people, and I'm very confident that we'll be able to get this sorted out for you.
That sounds great, Doctor. I really appreciate your help and understanding. I'll make sure to come in for our next appointment so we can start working on the plan. It's a relief to know that there's a way forward and that you're confident about helping me through this. Thank you so much. Looking forward to our next meeting.
Did you have any other questions before we finish up today?
No more questions from my side, Doctor. You've covered everything really well. I just wanted to say thank you again for being so supportive and understanding. I'm feeling hopeful about the plan we've discussed. See you at our next appointment.
Thanks. That was great role playing, Dr. Aida. I want you to head about halfway through this consult that we've done, but I want you to be more assertive, even a bit aggressive when I confront you about the doctor shopping or getting medications from other doctors. Do you think you could do that?
Certainly.
Okay, so
I
let's
can adjust the role playing to be more assertive and even a bit aggressive when confronted about doctor shopping and obtaining medications from other doctors. We can pick up from that point in the consultation. Just let me know when you're ready to resume.
Okay, Alix, look, I've got some confronting news here, really. We've
Yes,
actually,
Doctor? What's going on?
look, we've checked in, and it does seem that you've been shopping around to a lot of doctors and getting prescriptions for Valium and Xanax, and so I feel like you haven't been totally upfront with me.
What? No, that's not true. Look, I just needed help with my sleep and stress. You don't understand how hard it's been. I went to other doctors because I wasn't getting the help I needed. I'm not doing anything wrong here. I just need something to cope. That's all.
Yeah, I understand it's been really hard, and I know that you're struggling with a lot of stress, but it does look like you have been going to other doctors seeking medications. And so I'm very worried about problems such as addiction, which are pretty common with these medicines, actually.
Addiction? That's a bit much, don't you think? I'm just trying to get through my day-to-day life. You're making it sound like I have some serious problem. I just need a little help to get my sleep back on track. Can't you see that? Why is it so hard to get the support I need?
I'm very happy to support you with your sleep problems and your stress problems, but I won't be able to write you a prescription for benzodiazepines today. It's not personal, it's the way I work. And in fact, it's actually part of our rules as doctors not to prescribe medications of this sort when we're worried someone could have a habit or addiction sort of problem.
But that's not fair. I'm telling you I need it. You don't get how bad it is. I can't just stop. I've been relying on it. There has to be some way you can help me with this. I can't just go without it. Isn't there something else you can do?
Who's your regular doctor that you've been going to?
I don't really have a regular doctor. I've just been going to whoever could see me at the time. Look, I'm just looking for some help here. Can't you understand that?
Yeah,
I'm not trying to do anything wrong.
Yeah, I'm not judging you and it's not personal, but I won't be able to write you a benzodiazepine prescription. But I'm more than happy to help you with managing your stress and managing your sleep and trying some alternative approaches. Would you?
Okay, I get it. No prescription. So, what's the plan then? How are you going to help me? Because I can't keep going like this, doctor. I need some kind of solution.
Yeah, well, I'm happy to help you. And it's the first time we've met today, so I'd like to put in place a little bit of a plan. Would you be willing to be linked in with a psychologist to sort of talk through some of the stress management issues? And also, are you willing to try some non benzodiazepine approaches to sleep?
Yeah, sure. A psychologist could help, I guess. And I'm willing to try other approaches as long as they actually work. I just want something that helps me deal with all this stress and sleep better. So, what are these non benzodiazepine approaches you're talking about?
Okay, let's start working our way through those.